All right, hey, good afternoon. My name is Dre,
Hi, and I'm Martha McLean,
and I'm sorry, go ahead. And I'm the admissions manager here.
and I'm the Director of Nursing here, this lovely, unique community of Knollwood.
Absolutely, and we're here to give you guys some information about the long-term care services here at Knollwood and answer any questions that you may have. So, yeah, we're gonna get started. I just want to make sure before we get started, though, can everyone hear us? If so, awesome. If not, just type us a little message so that way we can make an adjustment with our volume. So far, so good. All right, awesome. So we'll go ahead and get into it. So a quick overview of Knollwood. Knollwood is operated and managed by an Army Distaff Foundation. So this organization was created to help service people who are in the military or wives or women who were related to military personnel to help give them healthcare services, whether it be for short-term rehabilitation or long-term care, and it helps to support their community as it began to age and the health began to decline. Knollwood is a beautiful campus. It's located not too far away from Rockville Park. And
The beautiful wooded, clear, near Rock Creek Park.
Rock Creek Park. And Rock Creek Park is a beautiful park. We have a beautiful campus. It's located here in Northwest DC, and it's specifically for individuals age 62 and over. With Knollwood community, we are a life plan community, which means we have several levels of care here, including independent living, assisted living, and skilled nursing. And we'll talk about those a little bit more as we progress through today's webinar. But as far as Knollwood is concerned, it's actually somewhat of, I guess I wouldn't say rumor, but people don't understand. Knollwood used to specifically cater to the military crowd. However, we've seen an opportunity to expand our community and open it up to the public. So we don't just service military personnel or relatives of military. We service the entire public because we do see a need for our services in a broader spectrum. A little bit more about myself. So again, I'm the admissions manager. So my job is to help transition people from a hospital or from home into our facility and make that transition as smooth as possible. So my biggest role is to build relationships with our local community and with hospitals in the area to make sure people know what we do here at Knollwood and to provide the services that we offer here at Knollwood at our 5-star community to those people. And again, I want to make that transition as smooth as possible. Speaking of our 5 levels of care here at Knollwood, like I mentioned earlier, we have independent living. So with independent living, those are for seniors who are completely independent. They have no need for nursing care 24 hours or even part-time. And these are people who want to enjoy living in the community, have access to our wonderful amenities here, while also having the security of knowing if they need to transition to assisted living or skilled nursing or long-term care, they have that option. With assisted living, those are for individuals who need a little bit more assistance, and I'll turn it over to Martha just to give a little bit more information about that.
And within our assisted living, we do have 4 levels. We have residents that just need simple minor assistance, limited assistance with their activities of daily living, or QN, especially if someone just, needs some form of QN and guidance to complete the task of the day. That's level 1. We have like level 2. They do need a little bit more assistance than usual, such as medication management, simple tasks of activities of daily living. And then we have level 3. Those residents do need a little bit more help, maybe depends on medications they're taking. Maybe it's a subcutaneous injection that they need the nurse to assist them with, or they need some form of assistance from this certified nursing assistant to keep them well groomed for their daily activities. Then level 4, they do need more assistance than all the other levels, but mostly there would be transitioning to our skilled nursing facility for long-term care. Okay.
And then going back to our different levels of care, like I mentioned before, under assisted living, we also have skilled nursing. Within skilled nursing care, we do short-term and long-term care. With our skilled nursing, it's divided into 2 areas. So we have HSC, which is Health Services Center. That's for patients needing subacute rehab, physical therapy, IV treatments, things of that sort. And then we also have our SCC, which is our memory care unit, and that's specifically for patients needing more assistance with some cognitive impairments, whether they're suffering from dementia or Alzheimer's, those sorts of I would say
Cognitive
conditions. We service that community there with SCC. This will move on to the next slide.
Again, I am Martha McLean. I'm the director of nursing here at Knollwood. I've been a nurse for over 13 years. I have been here at Knollwood for a little over a year. I started off as the clinical director, assisted living manager, and then I transitioned to the director of nursing role here at Knollwood.
All right. With that, we'll move on to the next slide. So we'll go into, I guess, a little bit more about Martha's role as a director of nursing. So I guess you can talk a little bit more about what you do on a day-to-day basis.
So on a daily basis, the role of the director of nursing is to ensure all clinical, are directed appropriately, timely, according to the current standard of practice, using guidance from CDC, Department of Health, and all other pertinent parties or group, companies, organizations that regulate the care of the patients. We also work on mentoring, development of the staff to ensure that their skill sets are enhanced through education, motivation, empowerment, and overall just make sure the care for residents provide that personal centered care for each patient that come into our community, whether you are here for short-term care, short or long-term care, or just going through the continuum.
Yeah, here at Knollwood, we feel every resident deserves to feel safe, valued, and truly cared for. We make sure we treat every resident here as if it's one of our own family members. Make sure everyone here, we treat them with respect. And obviously our goal is to make their stay here at Knollwood as comfortable as possible. So with long-term care basically is a variety of support and services that meet a person's health and personal needs when they can no longer perform everyday activities on their own. So if you're an individual who has recently seen a decline in your health, maybe you've had a stroke or taken a fall or seen a cognitive decline, long-term care may be an option for you. The idea is that you're going to need that 24-hour care in order to be maintained and make sure you're maintaining a high standard of living. And I don't know if there's anything else you want to add to that.
Maintain a high standard of living with respect and dignity, as well as personalize your space so you feel at home. There are patients that do come into our community that this is it for them, and we want them to feel as home as only as possible. And we do have ones that come in for short-term rehabilitation, and then they're discharged back to the community. So the goal is to respect, dignity, personalized care, make everyone feel special and unique, like the unique facility that we are.
Awesome. It looks like we have a question. It says, what kind of long-term care does Knollwood provide?
Okay, so for long-term care that Knollwood provides, usually we are a CCRC, so we have a continuum. Patients, they move in through our independent living, then they go through the continuum. So for the patients that are unable to live in our independent living apartments, then they would transition to our assisted living, where the CNAs or nursing staff would provide for them during that 24-hour period. If we are able to manage your care within assisted living, this is when now they're transitioned to our long-term care unit. So the long-term care is basically an uptake from what is provided for them in assisted living or a skilled nursing facility. It's just that we have a skilled nursing facility within our community.
Yep.
And within long-term care, you also can get rehabilitation. You have a dietitian, you have activities, there's a social worker, then we have the nursing staff.
Great question. Move on to the next slide. Also some other things to consider. people who typically need long-term care kind of develops gradually over time. So as you start to see your health and maybe your cognitive ability kind of decline, that might be a sign that it's time to start considering long-term care and get your information over to us. The easiest way to do that would be to get your clinical information, either email to myself or to our director, Beverly Morgan. That way we can forward it to our clinical team and also to our business office, just to make sure it's going to be a good fit and to make sure that we can assist you and help you to either A, regain your level of strength that you had before, or B, at the very least, take care of you and again, treat you with the dignity and respect that you need. As people become frailer or as existing illnesses and health conditions worsens, we want to make sure that we're here to support you and to make you feel as comfortable as possible. Moving on to the next slide. Knollwood is a 5-star facility. That's on Medicare and Medicaid. And all of our beds here are duly certified. And as far as our level of care is concerned, we've won several awards, as you can see here, from the best nursing home, U.S. News, as recently as 2025. So we continue to maintain a very high standard of care for our residents here. And again, we just want to make sure everyone understands that we respect all of our residents, and we want to make sure that they are really rehabilitated as quickly as possible. We go on to the next slide. So long-term care in Knollwood. I don't know if you want to talk a little bit about this.
So long-term care in Knollwood, it's 24 hours. Make sure the needs of the residents are met on all levels, whether it's medication, psychological, social, activity-wise, nutritional, their needs are met. Basically just provide for them to make sure if they were in the community, personalize their space, personalize their food, get likes and dislikes from families, and just make them feel at home while they're at home.
Definitely. Our entire interdisciplinary team is involved with the process. So whether it be our activities department, our social workers, our clinical team, we're all working together as one unit to make sure we provide the best care possible. So we have an on-site dietitian. We'll help with any ADLs or activities of daily living. So whether that's using restroom, medication administration, we have Verizon set up here. So we have quality internet. If you want to browse internet or watch TV, housekeeping happens daily. It's a very clean facility. As you walk through, it doesn't matter if you walk through independent living, assisted living, or a skilled nursing and rehab facility. You won't have any smells or see any stains or dirt. We do a very good job of maintaining our facility and keeping everything clean. Looks like we have another question. The question is, what steps does one take when they need long-term care? So like I mentioned earlier, whenever a person begins to see their health decline, or if a loved one who is responsible for a senior begins to see health decline, that'll be a good time to reach out to myself. You can use my email address, lhoward@knollwoodcommunity.org, or Beverly Morgan. And from there, we'll take a look at that clinical information, consult with our financial team, our clinical team, and even our therapist. Therapy is something that you're considering, just to make sure everything is a good fit. And then from there, we'll get the ball rolling on getting that person admitted to Knollwood community for their long-term care. So pretty much in short, just reach out to us and then we'll take over from there and acquire any other information that we need. That was a great question. Martha, anything else you want to add to that? Awesome. All right. Move on to the next one. The cost associated with long-term care here at Knollwood, the price is $634 a day. And with that price, something you want to add to it?
We do have the auxiliary charges. Depends on what your levels are, what your needs are. If you may have a wound care, wound treatment, nebulizer treatment, the beautician, if you need to have a rehab, speech, occupational therapy, as well as physical therapy. So all those are considered extra, which is auxiliary charges. We usually provide an auxiliary charges list annually, the beginning of the year, so residents or prospective residents can have an idea of what those charges are before that appointed time.
Yeah, and on this slide here, it shows what some of those ancillary services are. So physical, occupational, and speech therapies, that's something you're interested in, that would be an additional charge. Transportation, whether you have appointments things of that sort. That'll be an additional charge. And then if you want to use our salon or barber shop, extra charges as well. But the $634 a day is just kind of the ballpark where you will start, and then any additional services that you need, the price will go up from there. Looks like we've got a couple other questions. First question I have the PT. Oh, gosh, who can come to Knollwood for long-term care? Also a great question. So again, there's a myth in the community that Knollwood only accepts military or family of military, and we're actually open to the public. Again, Knollwood and Army Distaff Foundation found that there's a need in the community for the public to use and benefit from our services here. So anyone can be admitted here to long-term care. Again, if you all are interested, feel free to shoot me an email or give us a call, and then we can get the ball rolling on that.
Okay. And if you have any questions, you may go ahead and add your question to the chat. Bring it down.
And I can say I am relatively new here at Knollwood. I've been here for just under 6 months. I've worked at other facilities before, and I can say that Knollwood is by far the best one I've ever worked for. As far as the people here, very welcoming. Doesn't matter if it's staff or our residents of the community. Also, everyone is very supportive, and it's very interesting the walks of life that people have had here. Obviously, we have a lot of ex-military, but we also have people who worked as physicians, attorneys. You'd be surprised at the number of people that you'll meet here and the type of relationships that you'll begin to form with the people here at Knollwood. Anything else?
I would add, there are also residents here that are still working part-time or PRN.
Yep.
They're very active in their, former community, and they're also active here in Knollwood.
All right. Looks like we got another question. If you are in independent living and need assistance, will you have to move to a different room, or can you stay in your apartment and receive assistance there? So the question is, if you are already an independent living resident and you need to transition to
Assisted living or ill.
Person, yeah.
So we usually, safety is paramount for us. We want to ensure your safety is maintained. So we usually evaluate each unique case and determine what is safest for the patient. So yes, we advocate for patients to transition to assisted living or the skilled nursing facility. But at the same time, if you're able to maintain your safety with 1 or 2 hours of family visit or private duty aid, we do support that as well.
Awesome. Another question. If you live in Knollwood and need short-term physical therapy, are you required to move into assisted living? And that answer is no, you aren't required to. So we do have cases sometimes where one of our assisted living residents has a decline in health and they need to be transferred to the hospital. Because we do offer the skilled services here for short-term rehabilitation, what will happen is the hospital will send over the clinical information to us. From there, we will review it, prep the room for skilled nursing. From there, skilled nursing short-term is anywhere from, we usually say typically between 20 to 30 days, correct? 30 days. And then after that, the resident will be transitioned or transferred back to their assisted living apartment. So you are not required to stay long-term care. If you're already one of our assisted living residents, we do offer short-term rehabilitation as well. So yeah, great question. I will say also that's one of the best benefits about being a part of our Knollwood community. You know that if you are an independent living resident and you do have a decline in health and you need that short-term rehabilitation, your apartment will still be there, but you can have all the services offered in-house with people who are already familiar with you as an individual and familiar with your medical status as well. And then if the event arises where you do need to transition into long-term care, we can have that conversation with you and you'll know you'll be in good care with us.
And familiar faces. That's the name.
Pets
are allowed, but the policy has to be within a certain weight and then has to be vaccinated. And, cannot be aggressive. Say it were to be a dog, cannot be aggressive because safety is also an issue for the residents as well as the staff. But there has to be a dog that is trained, house trained, and, leash has to be applied when outside. And, yeah, you have to just, once vaccinations are provided, you just have to keep us updated. But yes, pets are allowed. including our assisted living.
And I think the pets enjoy living here just as much as the residents do, so, yeah. If there aren't any other questions, we have a couple resources for you. With the National Institute of Aging, CMS, Medicare.gov. Also, you can feel free to reach out to myself, Martha, Beverly, our director. We'd be more than excited to answer any additional questions that you may have. And with that being said, it was a pleasure talking to everyone. And anything else you want to add, Martha?
Just giving everyone an opportunity. Do you guys have any additional questions?
All right, awesome. Well, thank you all so much for
Thank
your
you.
time.
Have a fantabulous rest of your
Have a
day.
good rest of your day.
Thank you.